Hello everyone, my name is Andy Jeon and I'm currently a junior doctor at Fiona Stanley Hospital. With my supervisor, consultant anaesthetist Dr. Leena Nagappan, we've conducted a retrospective cohort study for all vascular cases for 2020. We have conducted this study to support the anesthesia department's case to launch a high acuity facility in the form of an extended recovery unit for post-operative management of high-risk surgical patients. As a result, this unit aims to reduce post-operative morbidity and mortality, given that patients will have reduced complications with earlier access to a monitored environment such as ICU. Therefore, this study was designed to identify patients who will benefit from the extended recovery unit. Specifically, the aims of this study are to determine the incidence of MET activation, incidence of unplanned post-operative ICU admissions, and identify types of vascular surgeries associated with post-operative MET activation. This retrospective cohort study considered all vascular patients for 2020, including both elective and emergency cases. However, patients with a planned post-operative ICU admission and/or incomplete medical records were excluded. As seen in the middle of the poster, 680 patients were eligible and were risk stratified using the surgical outcome risk tool into either standard risk, which is less than 5% for 30-day mortality, and high risk, equal or greater than 5% 30-day mortality. As seen in the top right of the poster, for MET activation, high-risk patients were 5 times more likely to experience a MET activation than their standard risk counterparts, 29% as opposed to 6%. For ICU activation, high-risk patients were approximately 8 times more likely to experience an unplanned ICU admission compared to their standard risk counterparts, 16% versus 2%. Ultimately, the implications of our findings are that the burden of high-risk vascular patients in a non-ICU setting during the post-operative phase is undeniable. Therefore, appropriate disposition planning is required, such as a stay in an extended recovery unit after their surgery. Thank you for listening.